Hello, everyone. Welcome to our LeClair monthly Medicare Connector training. My name is Sarah Korst. I'm the Director of Training here at LeClair, and I am joined by my coworker, friend, buddy, Ashley Spetsova.
Hello.
I know you loved that introduction.
I was like, how is she going to lead this?
I know,
Fabulous,
I have no
amazing,
idea.
perfect.
The one and only. We'll just wait for a couple of minutes here while people are joining. We know everyone's got very busy schedules, so wanted to make sure everyone had the chance to join us. If you are not familiar with LeClair, we're a field marketing organization. Our mission is to make sure that every community in America has a well-trained and well-supported agent to serve those communities. And we feel that these monthly Medicare Connector trainings are fit right into that mission. In today's age, I know I'm aging myself a little bit, but the technology that you're using and the way that you're efficiently handling your business and your clients is going to make all the difference. So here at LeClair, we're always trying to make sure we're at the forefront of any of that technology, making sure we put it in agents' hands and get them up to speed on it. So, today, if you have any questions, feel free to put those into the chat and Q&A. We are going to be covering client profiles and preferences. So this is probably one of the most important parts about Medicare Connector. It's what makes it so helpful and useful as a tool, is that the more information you input into the profiles, the more customized the plans are going to be. So it might be a little bit of review, and feel free to chime in if you wanted to have any questions about it or take it in a different direction. But I'm going to turn it over to Ashley in just a minute. But before we do that, just wanted to show on my screen here, if I get back to where I want to be, to our dashboard. When we are talking about accessing our Medicare Connector tool, there is a few different ways you can access it, and one of those is through our LeClair portal. So if you aren't familiar with our portal, please connect with us and we'll make sure we get you logged in. But if you are, this should look very familiar to you. Our dashboard here is going to have all of your personal agent information with appointments, policies, etc. along the side. Just going to quickly mention the education tab. If you're ever looking for trainings, in-person events, we have lots of these going on. This events tab under education is the best place for it. You can see here, today we've got this Medicare Connector training that you're currently attending, but every event is going to be on here along with links so that you can register. So we've got a first dollar workshop next week. We've got a couple of United Healthcare webinars the first week of May. And of course, as you go out a little farther, all of you will be attending our Healthapalooza conference in July. So just wanted to make sure you knew where you could get access to these. Moving into our content for today, under tools and resources, we have this Medicare tab. This, once you click on it, is going to bring you to the two enrollment tools that we have here at LeClair. So as a LeClair agent, you have access to both of these. We are going to be talking about the Medicare Connector tool today. We also have our CSG quoting tool that is perfect for MedSups and a few other products. If you want any information, let us know. But once you click on that Medicare Connector, it'll bring you right here, and then we can log in. So at this point, I'm going to turn this over to Ashley, who's going to walk us through the client profiles and preferences.
Fabulous. All right. Share my screen with you all. Can you see the connector landing page?
I can.
Fabulous. So we're just going to go ahead and log in. It's always going to be your username is your NPN and then your password, whatever you have set up. Go ahead and log into this. And we will land on our dashboard. If you have any outstanding pieces, all that will be listed here. You can access reports, everything along those lines here. But our focus today is going to be specifically on profiles and creating them for your clients. So what I'm going to do is I'm going to make the assumption that my client is brand new. They're a walk-in. I don't know any information about them. I don't have them in my system. So I will choose new profile in this situation. I'm just going to utilize the new beneficiary. I'm not using retire flow for this one, so just new beneficiary. And it will now bring me to some information to fill out my profile for my client. You will be required to offer up 3 pieces of information. So we have a zip code. I'm just going to use the office here, 55125. And then name for my client. I'm just going to say my client is Sarah. And Sarah's last name is Shvetsova. If you have additional information for this client, you can always put that information in here. So we're just going to say that my client's birth date is 06/13/1958, right? Would that be 65? So, and then if I have an email, I can put that in there. Just going to put in my info. Obviously, this would be tailored to your client specifically. If they have a phone number, anything along those lines, fill in whatever possible information you can because that'll help when you do the applications. And then whenever you have this info, you are just going to select Save. This creates that official profile for your client. So now, obviously build out all of this if you can. And then down here, if you have your client's, Medicare number or anything along those lines, putting that in is always helpful. Using the check eligibility. This piece does work. The Medicaid side does not actively work at this time, so just be aware of that. If you want to check Medicaid eligibility or even Medicaid statuses, you can always go into other carrier websites. I know that I utilize United Healthcare all the time for that sort of information when I'm helping troubleshoot that. So other places to do it, but you do have the ability to check here. And then right now we can see we have no quote history, no enrollment. All I have is this really basic information for my client. I don't have any notes, tasks, scope of appointments, nothing. So full blank slate. What I'm going to do is I'm going to scroll on down and I am going to do add preferences. And this is going to be how we build out our client's profile with their health needs, their doctoring needs, their prescriptions, their pharmacies, everything along those lines. So getting started, if we know what kind of pieces of information our client is interested in, we can select that information. I'm going to go ahead and just say, my client is interested in prescription drugs specifically. Do they qualify for anything? Nope, my client says they don't. So then I can just hit continue. And basically all this means is that because I didn't select medical, it's going to skip me right past their health and clinic information and jump me right into the prescription drug side of things. If we wanted, we could always change that. Go right back to our get started here and then choose, medical and prescription drugs. Same question would apply. Do they get help? No, they do not. And now it's going to push me into the health side of things. How many times, how healthy is my client is what we'd be answering here. In most cases, someone turning 65 is just going to be generally healthy. So we can go ahead and just keep them here, change our age range if we need to. Do I want to estimate my medical costs? For all intents and purposes for today, I'm going to go ahead and select yes. And now I can modify what kind of benefits I might be looking for from my client. So if I know I want to change these, my client wants to, see coverage for 1 ambulance service a year, just in case, those falls happen. We live in Minnesota. Chiropractic services, yeah, they don't want to go to any of that. They do want to have the labs and the testing x-rays, so we'll keep that at 4. Their hope is to not go to the doctor this often, but just in case, they'd like to have it there. Doctor's visits, they're just hoping for that annual checkup with them. Specialty visit, maybe my client is diabetic or maybe they have some other sort of condition, a heart sort of thing. So they want to keep those specialty visits open as a possibility. If we want to list any hospital or doctor, emergency care, whatever it is, all of that can be done here. And then once you're finished, you would just select save. And now this information will be tailored into the client profile and will show up later when I have the quote available for my client. So all my answers are updated. That all looks great. I'm going to go ahead and select continue. Now, some exciting news, guys. I don't know if I'm technically supposed to say this yet, so Sarah, stop me if I'm not. But we understand that the provider search has been a sore spot in the past. Connector has heard that, and they are making active changes right now to change who they receive all of their doctoring information from. In terms of filling in this area. So the hope is for the, halfway through the year here, we will see a new provider search engine attached to this that should be more accurate. It is currently in testing, centers and that area of work. So exciting, fingers crossed. Hopefully it'll be better in the future, but as always, if you do utilize this, just use it as a starting point for your provider searches, but always, always, always double check on the carrier websites for in-network providers just to be safe and to save you any possible complaints or hassle in the future. So in this situation, I'm just going to put in a really generic one. I'm going to say we go to a Dr. Johnson, their general practice. They're not value, so I'm just going to go ahead and select search. And now it's going to give me a list of all of the Dr. Johnsons, if there were one in this area. I'm not seeing one, so what I'm going to do is I'm just going to expand my search by moving in and out on my screen here. And then anytime you do that, make sure that you select search this area because that will modify if it is available. Okay, let's do no general practice. There we go. You can see my large search area. I can, zoom back in if I want to narrow it down. Search this area specifically, and it will modify my search results here on the side. I'm going to say that I go to a physician's assistant, a PA, instead of my actual provider. I'm going to say that this is now my doctor, just for, example purposes here. This is who I go to. Obviously, you would fill this in with whoever your client specifically goes to. We'd also just select this family medicine doctor if we wanted. So add provider as well. And we can see now that my other one is gone. And now I have this one. So I'm going to say that, yes, this is my primary care. Is this a new provider, or am I a new patient to this provider? No, I will not be. I already go here. And then we'll select add. If I wanted, I could go back up here and I could choose that PA again, select add provider. Is this my primary care physician? No, it is not. And then I can add it, and they are also listed as a provider I go to. So this would be where I could also add in my specialists. So if I had one in here that I specifically wanted, like I had a heart doctor or I had a doctor that helped me with my diabetes, whatever it was, this would be the spot to add in that sort of provider for specialty visits and things along those lines. I'm going to go ahead and just choose these two. Again, this information may not be 100% perfect. Always check the carrier websites. They are making changes to get a better search engine, but safety first. Go ahead and hit continue. And now we'll fill in my client's prescriptions. My client is on insulin. We already know, my client has this one here, one per month. We've got this vial. Perfect. That's exactly what they're on. If you knew specifically what you wanted them on, you could put that in there too. I can also write in that let's just say my client is on generic other medications. I always say that my client also is asthmatic. So I like to add albuterol as a possible option. Lots of different options here. We're just going to say that they use this Pro Air generic one. And you put that in there once per month, one inhaler, add. If you happen to have a client who is on a name brand medication, we could see that here. And you would be able to add in that information that way as well. Once I have all of my medications listed for my client, I would, because I have a name brand here and I have a generic listed, I'm going to go ahead and select continue. I do want to note that if your client does have a Medicare.gov profile where they keep all of their prescriptions, there is a way for that to be imported into the system. You would send them an email, they would approve it, and they would link the accounts. I'm just going to say I manually did all of this. So we're going to hit continue because I've got everything in there. And now I'm going to select my pharmacy. I'm going to go to the one closest to my work because I like being able to just pop right out of work on my lunch break and grab my medication that way. So I'm going to say that I go to this CVS pharmacy right here. It has been added. You can always add in multiple. Maybe I want to also add in a Walgreens. If your client is utilizing a online service, you just select digital and you should be able to grab whatever one they utilize here. So I'll also add in the Amazon pharmacy. And now at the bottom, we can see who is my primary pharmacy. I always go to CVS, so they will be, if the, if Walgreens was my primary, then I could choose Walgreens and I would change that. It is going to search by whoever your primary is first. So I've got my, the different places I fill my meds at. I'm going to go ahead and select continue. This will now bring me to the actual search results. So here's where I'm going to see all of my clients' information being applied. So their profile is built out. And now it is showing me their pharmacies. It's going to list their medications in here. So I'm going to get drug information. And then if it is an Advantage plan that I'm looking at, I had selected specifically what cost my client is concerned about in terms of doctoring, specialist, all of that. And I will be able to view all of that in the actual view more details area of the plan selection, plan profile. So looking at it here, I can see, with this UCare plan, I use $0 deductible, all that information. My drugs are on my formulary. My pharmacy is a standard and network, but none of my providers are showing up here. So again, this is where we want to be really careful with this section. It could be that these providers are in network, but they're at a different facility, they're at a different clinic location, whatever it is. So if you are using the provider network, just be very mindful that this information could be incorrect and to always double check it against the carrier specific tools. Scrolling on down, I'm going to go ahead and I'm just quickly glancing to see if any of these have my providers all on network along with my drugs. And it looks like I'm not hitting the jackpot with all of them together. So I am just going to say, I'm going to grab one of these other ones where it had one provider, just for example purposes, and one prescription. So I'm going to use this Health Partner $0 plan right here. Let's say that all of these other pieces were what my client wanted as well, but I wanted to view more details. We've got those total costs. We would do view more details. Now it's going to show me my Medicare star ratings, and then I would do, once it loads, view all plan details to be able to see my client's profile breakdown. Hopefully. If you found that you needed to add in more information, it's going to actually let me do it. You can always modify that in this next screen. You can modify that in a lot of different ways, and I'll quickly show you how to click on all of those different pieces of information. So it's bringing up all my plan details. You can see kind of in the shaded area right now what my costs are based off of in terms of my pharmacy and what my effective date is. This is modifiable for future dates only. It does not backdate. That is a compliance reason. But we're going to say I still go to the CVS. You can see all of the possible plan information, my summary of benefits, all of the other pieces down here, in network, not in network, covered or not covered, all of that information. And then because I built up those client health costs, you can see what are the potential costs my client would expect to see on this plan for the specific medical pieces I had selected for them. If we go to the prescriptions tab, we can see, how do their prescriptions fall in here. Because this is not a covered drug, this is what I was hoping to see. It is going to say view possible alternatives. So this is where it would give me generics or other pieces like that that might be similar and on network in formulary. For me to be able to do that way. But so that's, why it's important to build out your client profile. Now, let's say that we wanted to change some information. What I could do is go right up here, select Sarah, because that's my client's profile, and then I could select whatever area I wanted to modify. Let's say that I needed to modify their prescription section. I could click on this. It would bring me back to my client profile where I could then change, modify, add, delete, whatever it possibly is that I want to do to their prescription drug list to modify it and then get different plan results. You do that with all of the pieces over here. So that would be how we build out that client profile. In terms of also building out your client profile, if I just go back to the profile for my client here, we can view the information that I have readily available for them eventually. But let's say that I wanted to, now that I've got all of their preferences in, you could go in there and you could choose your scope of appointment and you could add in that information, document that it was a walk-in, all of that right within this tool to really build out their profile. So scope of appointment would be all the way down at the bottom. And I would choose continue to scope of appointment, where I would then be able to send this out and do all that information. We've gone through this on other webinars, so I'm not really going to touch it today. But the other piece that I do want to show you on here is when you are building out your scope of appointments, if I had sent one under SOA here on the side, right-hand side, it would say sent to client or, received back, signed, need to sign, whatever it is, all that would be listed there. If I wanted to add in notes, I could create a note or I could create a task, and then it would show up for me in the future for me to know under this client profile. So, for example, a good one is, let's say that, Sarah came in and her husband turned 65 in 2 months, 3 months, whatever it is. I could say, document for myself when I go back into Sarah's profile saying, husband turns 65 in August. So that way I know if I go back in, I can always double check, say, oh, that's right, your husband just recently turned 65. Does he have a health insurance agent? Let me help with that. Whatever it is. So the notes are there. If you wanted to add in notes of, preferred clinics, doctors, how to contact them. Maybe they don't like getting phone calls, they want emails. You could document all of that sort of preferences here under notes. If it was just things that you wanted to follow up on, you could put that there too. If you wanted to, you could build out a task. So maybe we sent that scope of appointment to our client. We've already got everything out, whatever it is, and I want to set up my 30, 60, 90 follow-ups. I could do all of that right within here, where I would then be able to go in, select whatever date would be applicable to what I want to do. Follow up to ensure they like their plan. Add task. And now this task will be not only under this profile, but it will also be on my dashboard for me to be able to see and note, and it'll list that due date for me. So all of that would be in my client profile, fully built out with all of my notes, whatever I possibly want on here for it. So now my client profile, for all intents and purposes, is complete. I have their contact information. I have their preferences in there for their doctors, their clinics, for their pharmacies, for their drugs. I have sent out the scope of appointment. I didn't do the live action here, but you guys, follow along with me. Sent out my scope. I've made my notes. I have set up a task for myself to follow up. This profile is happy, healthy, ready to go for future touch points. Any questions on this part so far on creating the actual profile for a new client?
I don't have any questions that have come through so far. You've done such a
Fabulous.
fabulous job of explaining that there's no possible questions. But I did really like, that you kind of paused when you had put in the providers and it's popping up as 0 out of 2 in network. We have had agents come back and say that clients that can upset them, even if you can explain to them that it could be an issue with the accuracy. But even the fact that they've seen that it's not in network can be hard to come back from. So I think that's a great point to bring up, is that if you're doing this beforehand without the client, it's probably fine to go in and check, but always keep that in mind of what is going to show when you're presenting it. And fingers crossed, I did put it in the chat, kind of our hope that we're getting the updated provider search and that will not be an issue in the future.
Right.
I
That's
know.
something I get all the time. So
Well, and
I'm
it's
really excited for this.
yes, absolutely. And it's very hard, I think, on everyone's part. But agents are asking us, they're like, I'm trying to figure out if they're a network or not. What tools do I have? And then we direct them to this. And if it's not correct, it's kind of like, well, it's like it's the agents wanting to do the right thing for their clients, and I just want to make it as easy as possible for them. So be
Exactly.
aware we're as frustrated as clients and
As you guys
agents
are.
are.
Yes. Perfect. So then what I'm going to do is, now that we've seen how to create a new one, I do just want to quickly review how to view a profile that has already been created. So what I'm going to do is, just in this example, I'm going to go back to my connector. It should bring me back to my dashboard to log back in, and my dashboard already pushed me right through. So here's a good example. You can see that I have my task right here, follow up to ensure they like their plan. This is for the one I just created. It does have a hyperlink where I could then go directly into Sarah Shvetsova. and then we'll be able to see their full profile I had created. Let's say in this example, I don't have that there, and Sarah walks into my office and I want to pull up her information and see, that we have everything ready because we're preparing for AEP, whatever it possibly is. What you would do is up here at the top, select search, search beneficiary. And now there are a couple different ways I can do this. I can search by their name if I know their date of birth, phone number, email, their, user, their Medicare number if I put that information. All of that would be right here. I'm going to go ahead and just search by name. And before I hit search, I just want to make one more quick note. You can see here that I have a completely blank slate because where that client profile would normally say Sarah, it is blank. That means I'm not accessing anyone's profiles at this time. I have a full blank slate to go off of. So you always want to make sure that that is happening, so you don't accidentally document or send out something in the wrong profile. Now that I've got all of my clients' information that I'm going to search by, because I don't memorize date of births besides my own, I'm going to go ahead and just put in their name, choose my search profiles, and it'll pop up right away. I can see, oh, there's Sarah, what's her zip code, their email on file. I can see that they're a registrant. This means that they are not actively applied for a plan through Connector. And so that's a good idea of if I've written them something or not. You can see my information and when I last touched this profile. So if I wanted to view Sarah's profile because she's standing here in front of me, I would then click on her information and it would bring me into the profile I have already created for my client. And then what I would do is the exact same thing I did previously, except it would be in terms of updating their profile. So if they came in and they're like, oh yeah, turns out I have a new phone number, I moved addresses, all of that could be updated right in here now that you have them in front of you. If they said, I'm no longer on some of those medications, all of that sort of information, I could then go back into their ad preferences, their scope, whatever it is, modify their profile, and then view the plans for my client. Another great thing is, let's say that I did have plans already selected, and I had sent a quote to my client to physically look at via email, then that would show up in here as part of my quote history. If I did apply for a plan with them, the application information would all be listed here. If they were on that plan, so on and so forth would be there as well. And that's how you would look up an already existing profile to modify it, edit it, however you want to describe that information. Do we want to see anything else? I know that was real quick, but a
I
lot of
think
it's
that
just
was
step-by-step explanatory, just kind of following through the links.
absolutely. And I think we've all been playing around in Connector for probably going on 3 years now.
Mm-hmm.
So it's easy to get comfortable in it. We definitely recommend just taking some time, create a bunch some fake profiles, but just spend some time in there to familiarize yourself with it. And again, at this
Speaking
point,
of,
if there's
oh,
anything else you want to see, oh, go ahead, Ashley.
I was going to say, speaking of profiles, this is something we get often. If you put in test accounts, always writing test in there or putting it under your specific name is great. Just so you can, try it out. Fair warning, do not go through the application process in a test profile because you will enroll someone in something and you could get docked by the carriers for that sort of thing. So just be aware. And then the other thing, and what I get all the time is people messaging me saying, hey, I accidentally forgot the A on Sarah's last name. How do I do that? One, you could go in and you could edit their profile. Or two, people say, well, I couldn't find them because of that. So I just created a new profile. And now I have two Sarahs in my account. What do I do? The best way to do that is to essentially put like an X in front of Sarah and an X in front of Shvetsova, because then that would put it all the way at the end. There is not a way to delete a profile after it has been created. And this is a compliance rule, not a choice sort of thing. They have to do this to comply with CMS. So adding in something at the end of the alphabet, an X, a Z, whatever it is that you possibly want, will push it all the way down to the bottom of your search results so that you know what is the current one and what is the bad one.
That's great advice. And yeah, we've definitely got that a lot from people, but I think you can see why we wouldn't want anybody to accidentally delete any profiles.
Right.
That's much worse than having duplicates. So I agree. Either having a consistent letter if you're using X in front of ones that are kind of defunct, or Z, either one of those can be great. Um, that's a wonderful point to bring up. Well, we're just about a half an hour. So if there's anything else we'd want to cover, whether it's questions on creating profiles, whether it's questions on preferences, we can do that. We can also talk about any other topics you might be interested in if anybody had
Yeah.
any additional ones they wanted to discuss. And while we're waiting, we'll stay on for just another minute, but just wanted to remind you that we have these monthly trainings every month. So we try to tackle kind of different topics, go in and um, break them into kind of manageable training sessions. We always record all of these, so if you wanted to watch them at a later date. And then we have a what we call kind of a full training recorded from our January session. So if you have somebody who wants an overview of the platform or a refresher, let us know. We can always send those out to you. If you have any topics you'd like us to discuss in the future, let us know.
Hmm.
If you just love hearing us chit chat, you can check out our podcast that Ashley and I do. It's called Always in Network. We have a couple of episodes banked, but if you just love our discussions, and please join and let us know. But at this time, I think we're all set. Ashley, thank you so much for walking us through the training today.
Yes, thank you everybody for having me. I look forward to seeing you on next month's training. Like Sarah mentioned, in the meantime, if you want to go back and rewatch any of this, Sarah will send out the recording after this. But also you can access it in the LeClair portal under the education section, webinars on demand. This episode specifically won't be up for, a little while. But you can see all of our old ones, including last year's, where we also cover the same content if you wanted.
Wonderful. Well, thank you again, Ashley. Thank you for everyone for joining us, and have a wonderful day.
Sounds good. Thank you.